We here at JPS are extraordinarily mission-based, and so we understand our mission of our training, knowing that we are training our replacements, we're training the future of obstetrics and gynecology. It's truly an incredible place to train.
OBGYN residency is going to be hard no matter where you go, and so looking for a place like JPS where you're going to be well supported, I feel like you get the best of both worlds in that you're at a very busy hospital, being exposed to all sorts of pathology and different patients from different cultures, so you're getting great training, but you're also in a place where your faculty and your co-residents really care about you, and just the culture is very inclusive. Everyone wants you to succeed.
You will get above and beyond the amount of cases. So you will see the most simple cases that are the bread and butter, or you'll see the more complex cases that are going to be difficult, but really push your surgical skills and your medical knowledge to help prepare you for whatever you're going to see or be a part of outside of residency, which is huge.
I think what makes training unique is because you don't have as many layers where you have not only the residents, but you also have fellows. And that's what I've always said here. The OB/GYN residents are able to work directly with the subspecialists, whereas at any other program, those subspecialists are usually training their fellows. And so you're getting the same level of training potentially, as well as the direct connections with the subspecialists.
The residency is geared towards the interns getting their vaginal deliveries and really mastering a vaginal delivery and how to repair any perineal lacerations or any lacerations that come after delivery. We're also responsible for like postpartum rounding, clinic visits. We kind of handle the gynecology visits as well as obstetric routine OB visits, which is very cool because that's kind of what your life will be like probably after residency.
You get a lot of surgical training primarily starting in your second year. You start to do stuff on your own, you start to do more minor cases. That progresses through third year, and then fourth year is when you book a lot of your own hysterectomies and major cases, and you get to take a lot of ownership over them, which is what I liked. Like you book them, you pre-op them, and you said, I would like to do this, and then you do it, and then you learn a lot from that. But yeah, you gain a lot of confidence and comfort throughout that time.
They see patients in the office, they're able to work with them to plan their surgeries, they're able to operate on those same patients and then see them for their post-op care too. So we have excellent continuity of patient care built into this program.
The patients are excited to come and see you when they're pregnant, and getting to help them through one of the hardest times in a woman's life, but also the best times of growing a family has been something that's really like nothing other.
I think JPS does a really good job of just allowing our residents to learn and feel comfortable, and more importantly, feeling comfortable talking to their attendings if they are not comfortable with something. I think that's not what you see in a lot of residency programs. You can feel very comfortable with talking to your attendings if there's any questions or any concerns.
It really is like a family environment. I feel like anytime we get together, it's sent in the group text to the entire residency to join. And so that's been really great. Moving to a new city, you already have 18 to 20 friends that you can count on to hang out with you outside of work, but also just seeing them around the hospital is always a joy. Even if you've had a long day or you're post-night, seeing your friend is just kind of taking your mind off things. And so I found that that's really special about this place.
I think that companionship among us is like really important for how we interact in the hospital.
So I think that's going to be like the highlight of it, is just the people that I worked with, absolutely, including residents, nurses, attendings, all of them.
When they first get here, it's the very first time they've been called doctor, and that's very overwhelming and intimidating for them. But to really see them grow, not only in their skill set, but in their confidence level, they're so much stronger than they know at the end, and they're not going to figure that out until they leave. But we know that they have worked really hard to get to where they are. And so just to see them at the very end and to know that they're ready to go out into the world and practice on their own, I think is the most gratifying part of being part of the faculty here.
If you come and train at JPS, you will be an excellent physician that is completely ready for independent practice. And I think you will also really have enjoyed your training and continue to have that kind of passion and the reason why you wanted to become an OB-GYN and women's health provider, just continue on into your private practice and transition after residency.